Welcome to the first press conference of 2021, and I seem to, Casey, after all the length we did, I seem to have the wrong notes. I have the notes for the Thursday, December 17th one. Can Kimmy bring me my notes for the other one? But I will get that.
Yeah, we'll get you the other ones.
Well, I'll start off first off by saying, obviously, happy to be here. Hopefully, everybody had a good Christmas and a good New Year. Obviously, I've been out for a little while. I was out last week, anyways. But as it turned out, I think on Monday, the 21st, I think I told y'all I had a COVID exposure. It was my son who did not realize when he came home from law school, ended up bringing COVID back with us. Sure enough, on Wednesday I had a test. The test came back positive, so I tested positive for COVID. Did my time away. I guess with Christmas and everything else, stayed fairly up to doing what I was. But by the time I got to last week, I decided I wasn't going to shave. I wanted to look like Keith Wilkins, so I haven't shaved here for a week. But coming back in, just wanted to say I was glad to be back in, healthy, everything ready to go. Certainly, we went through the COVID experience for the holidays like many people in our family. My son had it a second time. He managed to give it to me and my wife. Although originally on Wednesday we both tested, I told her the test confirmed what we've all known for a long time, that I was positive and she was negative. But anyways, she did test after Christmas again, came down with it. So she's just finished up with hers, finishing up today. So we have gone through it. We certainly have experienced it. We felt very fortunate that we did not have an adverse effect, but obviously this is the problem with COVID is some people have very strong reactions and some people don't have reactions at all. And I'm waiting, Casey, to see if I haven't gotten the update. It's coming to me right now. There we go. So as we start in here, I guess much of it is talking about COVID. Obviously, where we are, our positivity rates have been fairly significant. The last update for the state shows a 20.16 positivity rate. For Escambia County, they showed a 20.16 on the second. The first was 15.34, 15.57, and 14.8. Again, these are fairly significant. The new cases we've seen go up fairly significantly over the last couple of days. Certainly our biggest thing we continue to track is hospitalizations, which on the 30th went for the first time since last July, went over 200. On the 31st, we were down at 198, but then January 1, 221, 225, and 237 yesterday. So we are 9 short of what was the record we hit last time. So we certainly are having those challenges. I think the biggest thing that we've got, we don't have the same impact to deal with the mask. We hope you will wear your mask. It is the most significant way that we can deal with COVID, and so we hope you will do that. But obviously, I think the bigger thing to do is what we're pushing now more to, and I look forward to catching up with the hospitals today at 2. I think much of our discussion will be centered around where we are with the vaccine. I know the last time we communicated it was on the 21st, 2 weeks ago. I did that virtually from my house. That day I did my last press conference. I communicated with them, and we were moving forward with getting our people ready to be tested. I know it's now rolling out, and we're beginning to have stuff available for people in the general public, obviously starting with those of significant age who have more impact. I think we'll be seeing it continue to start there. But as we move forward, we'll see it come out there, and I think this is really going to be the way we move forward. One of the things that did come out of that discussion was because this is a two-part, exam, or the way it's administered, with 30 days in between. the true effect really probably won't be felt until probably 75 days from when it started, which was the 21st, which really sort of put us around March 1st, a little bit right after the beginning of March. These were discussions that we had on Tuesday with Mardi Gras. Last week, you probably saw Mardi Gras Pensacola made the decision to postpone their events for this year, at least in the January, February timeframe, and come back in May. They made this decision on their own. We advised them what we were hearing from the hospitals. They made those decisions. Certainly, I think by that time in May and June, we certainly expect to see impacts of not only what's happened with the virus, but the vaccine to have a significant impact. Certainly seeing the numbers that are going through and people that are getting the vaccine, we want as many people to get it as possible. And I know in the conversations I'll have this afternoon with the hospitals, we'll be talking about ways we can get people to get the vaccine. That's kind of where we stand on these things. Again, our CPAC meeting is tomorrow. Again, CPAC will be meeting tomorrow night over the holidays. I sort of submitted to them an email last week, talking to the chairman, Drew Buchanan, and telling him to go ahead and get sort of send out to his, and I think Kimmy was sending out to their whole group, looking at their second meeting in January, trying to have our individual who's going to be helping us with crafting our new search for a police chief to be there to get input from them. So they will be doing that. This meeting tomorrow, we'll have plenty of things they're talking about. But on the second meeting in January, I think they're having a session really dedicated toward providing input for the police chief and the person that will be doing the search. So that's a little bit about where we are at this particular time and what we're looking at. Obviously, for me, it was a good holiday and a chance to have some downtime and reflection and look at some things. I think our biggest challenge is we have a number of great things that are happening over the end of the year. There were again two biomedical groups that are looking to open operations and businesses here in Northwest Florida. And again, I continue to be excited about what I see happening in our community. And so much so, I got something from Matt Coughlin talking about the airport. Again, we were down 34% from last year, but that was still very strong nationally. So many of the things that we're doing, we are still well positioned. Obviously, the biggest thing out there is continuing to be COVID. And I think the problem that we have that I see with COVID is really just an inability for us to get a cohesive sort of picture going forward. And part of that is just simply what we see in our community. And that's not just localized to Pensacola, it's really all over. And it's unfortunate that there's so much of an impact to something that was fairly simple that we could work ourselves through, and we just need to get through it. Certainly, we hope all of us will continue to do what you need to. Now is the time for us to be wearing masks where we are with the community spread. We certainly need to be doing that. I think the other part is clearly we need to be getting vaccinated. But the biggest part is just working to get to that point so that we can find ways to work together. We have great opportunities sitting in front of us as a community, but we really need to get through COVID. And if we can do that, we stand in a very good position as we move forward. So that's really all we have really to talk about at this particular time this morning. I'm more than happy to talk with you and answer any questions that you may have.
The first question is from Dave at WWF. Given the disorganized nature of the vaccine distribution, could or should cities step in to lend a hand?
Well, I mean, I think we're trying to work with that. I think I know I got some stuff over the weekend. I know Lawrence has been working with the county and what they're doing over at with community health. I mean, the way I mean, if the state chooses to roll it out through municipalities and jurisdictions, we'll be happy to help. At this particular time, we're more of a sideline player and the decision has been made to move through hospitals and Department of Health. So along that line, we will help in as many ways as we can, much like the joint effort that was going on at the Brownsville Community Center. If we have the opportunity to further establish those in community centers inside the city, we will be more than happy to work with that and offer that opportunity. And I'll be happy to do that today. But again, I don't think, unless we're asked to do something, at this point, I think what we'll see is it's going through those health organizations, and they will be the ones administering. And we are here in any way we can to assist, and we're already doing that. But we're more of a backup role, and we will continue to function in that role.
And I am experiencing a bit of a lag on my end, so I'm just going to ask the questions without sending myself live, just to avoid any confusion, because I think I left myself up a little longer than I needed to. The next question is from Jim at the News Journal. Can you explain again the timeline for when you believe you were exposed to COVID and when you tested positive?
Yeah, absolutely. I'm more than happy. My son came home on Wednesday, which was the 16th, I believe, of December. We had a chance to briefly see him, but we really spent a significant amount of time with him on Thursday evening when I got back from work. And we had some drinks with our neighbor over, and we went out to eat that night. Came back the next morning. I got up, came into work, didn't really think too much about it. He called me that morning and said he wasn't feeling well. We got him in for a test. That test came back Saturday evening. We got it back, indicating that he actually had COVID. So at that point, I went and readdressed all of my schedule for that week before Christmas, not knowing as I thought I had an exposure, but I didn't. I wasn't. I've been at my house since Saturday. What was that? The 19th. Saturday the 19th. I was there at my house, and pretty much until I went and took a test on Wednesday. I knew I could have gone Tuesday, I guess, but just wanted to make sure that was 6 days from my exposure to make sure I didn't want to go too early and then find out it was negative and I really was positive. So I wanted to wait sufficient time. I knew 6 days was a good amount, so I knew I was going to go Wednesday. I had my first symptoms on Monday. I kind of had a ache in my back and I had a slight fever in the sense it's about 99.5, 99.9. That's really about the end of what I had. I had a chance to. I'd been working on something with a neighbor around the corner of ours who had COVID, and she told me, she said, well, you need to get vitamins A, C, and D, and because I always take a vitamin, but it's just a regular, just whatever. She said, no, you need to get extra and melatonin so you could sleep, because I was having that backache problem. It was kind of achy back. I could feel that. By Tuesday, I felt great. By Wednesday, I went back down again. That was the day I got tested. Found out I was positive that afternoon. But I had been in isolation since Saturday and continued in isolation. I did have a chance, was it the 27th, that Sunday? I got a call from Department of Health. They talked to me. They walked it through. They said, hey, you can go back to work on Friday, which was New Year's Day. That was 10 days. So I said, well, that'll be good. I won't be going back to work, but I will. That will be good that I can get out, because obviously my wife was sort of behind me. So she's been through the weekend, haven't been able to get out. So today's sort of our first day where both of us can get out. My son came off, I think, last Monday, Tuesday. So it was his last day of being quarantined. So that's kind of our schedule as we went through it. We were, I think for the most part, things that I had a chance. We had already quarantined ourselves a good 48 hours before I started to have symptoms. And again, from that standpoint, we as soon as we found out my son was actually positive, we sort of quarantined ourselves, made the adjustments, and that's why I was not in last week. Turned out it was a good thing, and the right thing to do. And I think that's probably more effective than anything else, is if you're going to be positive, don't come in, don't go anywhere. Stay home, stay out of the way. That's what we did for Christmas, and it was a little bit unusual with a Christmas COVID, but COVID Christmas, but it all worked out from our standpoint, and we're ready to get back to it this week.
And I'm going to jump ahead because we got two questions about this that are related. Just clarifying that this is your son's second time testing positive for COVID.
Correct.
You're making sure you didn't have two sons.
Of course, the first time, I only have one son. This is the second time he tested positive. Of course, he was positive in April, sort of, when I talked with Department of Health basically has told me, they said for about 90 days, you neither can give COVID nor you can get COVID. So, but I will continue to wear a mask. It's certainly the right thing to do, even though I can't give COVID or get COVID for the next 90 days. Probably it's possible even longer, but it looks like it only lasts about probably that long. That's why certainly it's important that everyone get the vaccine. Obviously, though, they don't want you getting the vaccine until you've been out 90 days. So I won't be able to get the vaccine until April, but I certainly plan to get it at that point. I think my age group should be down to that workable point, and I plan to get it in April of 2021. But obviously, I will have had it. So again, it sort of shocked us. We sort of were thinking the same thing. We were like, hey, we don't really have to worry about him. He's had it before. Sure enough, he found out he was positive on Saturday. By Sunday, he had a chance to text up with some of his friends from law school. They found out that yes, indeed, there was, after they finished up their exams on Monday, the 14th, they did go out that night. After that point, they did find out there was somebody in their law school group that had it. And then many of the other people that went out ended up also getting it, I guess, and taking it back to their families. So we did get a Christmas gift from my son that was unexpected. So anyways, we got that one, and we went through it.
This is from Jeremy at In Weekly. Does the city have a role in vaccine distribution? If so, how is the city participating?
Jeremy, as I said earlier, Dave Dunwoody asked that question, and I think, what we were saying again is we're certainly going to be in any support role we can. If they want to use our community centers, we'll be happy to do it. I'm going to be on the phone today with the hospitals, and I think much as we've seen throughout this, that plan will continue to evolve. Right now, where the hospitals are comfortable is they're getting it. Department of Health is getting it. They're the ones administering it in those locations. Certainly what you saw, and I got some pictures over the weekend from Lawrence Powell that was there with what was going on at Brownsville Community Center. The county doing that, we were aware and working with them on that. From our standpoint, if they want to do that at any community centers within the city, we are more than happy to work with them. But I mean, again, the role will be we're here, we have any assets, we have people, we're here to be a part of whatever they want to engage the city. But at this particular time, we're not the lead agency, we're more of a support agency, and we will continue to operate in that capacity. As they get more vaccine and they have the ability to maybe administer it in different places and they want to look to the community centers, they're more than wide open, and I will communicate that today to all three hospitals. But at this point, no one's asked us to do anything. We're going to volunteer whatever we can do, and when they need us, we'll be able to implement whatever we need to.
This is from Jeremy as well. When does the city expect to see employees and first responders get a vaccine? And my understanding is for the last 2 weeks, both the week of the 21st and last week after Christmas, fire department has gone through and they've circled all the way through. Today is police department, so they are starting today, Pensacola Police Department. So they're the first two places. I think after that, we're looking at our public works, our sanitation workers, all those other things that are considered mission critical, which I don't believe the mayor is at that level yet. So again, I don't need to, I'll be able to get it back in April. By then my time will roll up, but obviously the most important people here at City Hall that we can't function with, our first responders are first. They're doing it right now.
and then we're going to go on to Public Works, sanitation, those services that are essential to getting essential work done. But we are rotating through. At this point, we're on police this week, so the police are going to be getting it. I think we sent out some stuff. I put some stuff on social media. I know my own personal social media last Monday. I got pictures from Jenny and her team, and I really appreciated them going in and allowing us to do that. Chief Craner, I think, and her team did a great job. I'm glad they got out there vaccine. I know Acting Chief Chrisman and his department are getting out there this week, and so we're just working down the line from there. And our goal is to obviously get as many city employees as we can. I think that's a big part about what this is going to be. At least talking with the hospitals 2 weeks ago, much of what the hospitals told us was, hey, when we can get our staff vaccinated, we know we don't have to worry about staff. You know, there's certainly a functional capacity on the space that is the hospital, but I think if you ask them what's more important or what are you more likely to run out of resource, physical location or employees, they would tell you their employees are much more likely to run out of. And so getting them the vaccine will allow them to maximize out what the capacity of the buildings are. Certainly the same thing we feel with our first responders. The more we have and know that we're going to have first responders who aren't susceptible to COVID and are vaccine, it's going to make it easier for us. That's been the two things we've tracked, as well as hospitalizations that we felt like are critical to us providing service. And we've had ups and downs, but overall we've been able to keep it. We've been able to keep it much more level. And that's really goes credit for both Chief Craner and when Chief Leiter was here, and now Acting Chief Chrisman. That's a credit to them in what they're doing and keeping their staffs, making sure that they're taking care of their staffs and having them prepared. So that's kind of where we are at this particular time.
And actually, just to clarify, Chief Craner was letting me know that police are not getting the vaccine yet. Since the governor changed it to 65 plus only. Oh. So I guess some members of the fire department got it before the governor changed it. So we'll be following, I guess, whatever the state's plan is.
Well, that was the last week when I was here. I wasn't here last week, so I didn't get a chance to get updated and know exactly what we were going. But the framework we were going to work on was police were supposed to be doing this week. So I guess whenever we get called back up, we'll get back in line.
And this is from Jim Little at the News Journal. Do you have a response to the police union's letter released last week calling on you to call off the search and hire Deputy Chief Chrisman?
I have a chance. I saw the letter. I want to get together with Pat Burns, the local, and I'll look to talk with the members of the police union just for clarification. I guess the concerning part to me is we're moving forward with this. The concerning part to me is I'm a little concerned. I'm not sure what this if they're saying they're unsure of. I mean, they're unsure of the ability. For Kevin to compete, I mean, he's very open to it. I've spoken with him many times through the last couple of weeks, and he's very feels capable. And I think it shows everything you want to see in the individual who you have in there that's acting, that they feel capable of competing with whoever. So, I plan to sit down and talk with them. Kevin never has asked me one way or the other. He's always felt like he's happy to compete and he's got the confidence, and I hope the union has the confidence in him. I'm not sure what that letter means, if they're not confident in him or where they are, but he has all the confidence he needs to be able to compete, and we'll see from there. We've worked that through with every other position. Again, we thought we had our position solved, and we thought we were going to have Chief Leiter here for a little while longer, but we certainly understand, and I think in his new capacity, we'll be looking forward to work with him, and I think it will certainly pay dividends as we move forward in the relationship that we have with making it a much better relationship with the Escambia County Sheriff's Office. So from that standpoint, we're excited to see what Chief Leiter offers us there. But obviously, that changed some of our expectations, which is why we've moved forward with the search that we're doing. And the one thing I will say about Acting Chief Christman right now, he has never said anything except he wants to compete. He thinks it's what he wants to do, and it's something he's wanted to do, but he's never thought of anything that he didn't need to be competing for it. So I think from our standpoint, we want to look at it and know that we've looked at everything we've got, and we've proven that whoever's going to get that position has the ability and is the best person to fill that position. So we're going to move forward with our process. I've communicated with y'all. I showed you certainly on our sheet and all the people that we have brought over, and I think it's fairly significant when you look at that list and look at some of the positions we've filled and the teams we've created. We've got a great team here, and I think from that standpoint, I think the process we go through has created quality people, and we've been able to see quality people rise through that process. So I'm confident whoever we get through that process is going to be a quality individual.
This is from Andrew McKay at News Radio. Given the very high positivity cases and now hospitalizations, have you asked Governor DeSantis for more resources such as testing facilities?
I think the one thing we need from the governor is not testing facilities as much as what we need is the ability to be able to do the mask that we've done. We've certainly asked for that. I communicated directly on my letter with, I know, CFO Petronas. I certainly understand that hasn't been a decision that the governor has decided to make. I mean, from a testing facility standpoint, I've just been at the testing point. I've had several people go there. I've talked to Sacred and some of the other people, and they have not told me they feel overstretched. I mean, they're certainly working and they've got capacity. But I think what I'd rather do than just get tests, I'd rather have something I could really combat COVID with. And obviously, if we had the ability to go back with our mask and enforce that the way we need to. And again, I was very clear with the governor that I understood, and I thought we should, as cities and municipalities and counties, if we get to a low point, we should take off the mask, and we should be able to do that and then come bring it back. And so that we make it very clear with the public that there are certain times that we need to wear a mask and other times we don't have to. But when we get into points where we have to wear one, like right now, it is essential that local governments have that capacity to be able to enact ordinances and enforce those ordinances. And at this particular time, that's perhaps more important of what we need at this particular time. That and the vaccines. Probably the vaccine is probably the most important part, and the state is moving forward to get that to us. And I appreciate. I can't say enough how much I appreciate on that side what they're doing. So I think that's probably number one. Number two would be getting the mask, and then number three would be testing. But again, I think we continue to see there is testing going on here. People are able to get tests. It's more the question of what do we do and how do we continue to fight it, and having the ability to go back to enforce that mask when we have this level of community spread would be important.
This is from Laura Hussey at WEAR. Regarding vaccinations, understanding the city is not directly involved in the process, but city residents are also county residents. We are getting a lot of calls about the fact that registration for vaccines can only be done online. There is no phone number provided by the county. That seems to be a problem for a lot of people who don't have computer access. Is this something the city can influence or might get involved in?
We certainly, I saw some of that coming through. We certainly can make those communications known. We'll do that today in our conversation with the hospitals. The Department of Health will be there. It's one of the things I think we can clearly say that we've got to find a better way to also do that, and that may be a way that we can work with within there to make that happen. But I think this is going to be. I mean, whether this was back in last March and we told you what was going to happen as we've gone through, I think this process will evolve. It will get bigger as it happens, and we will see it change and evolve over time. Right now, they're very comfortable with doing the vaccines through the Department of Health and the hospitals in a process that they have. I think as they get more confidence in understanding how to administer it, I think you'll see that change. I think you'll see locations expand. I think you'll see opportunities expand. And I agree. We want to make sure that everyone has an ability and a capacity, whether they have a computer or not. So we certainly will work through that however we can. But I think right now, you're seeing what they first roll out, and I think it will evolve as we go through, and we'll constantly be a part of making those suggestions. I'll make those suggestions today at 2 when I'm on the phone with them. So we'll try to make those suggestions, and we'll see where we go from there.
This is from Jim at the News Journal. Why such a delay in letting the public know you had a positive test?
Wasn't necessarily any delay. I wasn't here. I want the opportunity to do that to all of media at one time. And see, the easiest way to seem to do that would be the press conference. I mean, the fact that we had already, whether I had COVID or not, we had called the press conference for last Monday. I thought the best time to do it is to come here. Last week I was on vacation one way or another. I was with my family. So from my standpoint, I wanted to be with them. Didn't necessarily need to be working out with individual media. Those things are set up for this opportunity on this Monday. I mean, it's just the way the timing went. I mean, those things, otherwise we would have been here in a Monday, and I could have easily done that at that point. I did communicate with all of you last week on my press conference that I'd had a positive, at least I'd had a contact, and that I was at home because of a contact, and I was very clear communicating, and I will continue to do that with you when we're here. But if I'm out and I'm out of and I'm not scheduled to be here and I'm on my vacation, again, those times will be there, and I'll get to it when I get back, and I have the opportunity to sit in front of all of you. Certainly our goal is not to be favorites with one type of media or any specific media, or work with all of you, and the best way to do that is to be at these Monday meetings. We've been doing it now 2 years consistently. So there are things that we've done. This is where we do it. This is the best way to communicate it. And again, I was out last week regardless of COVID, one way or the other. I was on vacation. So at that point I was out, and I was going to explain it to you the first opportunity I had to come back another Monday.
This is from Jeremy. Sorry.
Plus, I was going to say, I will say I was doing exactly the one thing you want to do. You don't want to come in. I think Casey asked if I could do camera. I said, why am I going to get on camera? I said, I don't need to be around anybody. So, I'm going to do the one thing we were asked to do, which is go home, be isolated. When you're done with COVID, you can come back out, but we went into isolation. So I think that was the most important thing to do, was they're isolated. I'm more than happy. As I've said, we've come here today, and I'm happy to answer any questions with all the media here. What'd you have? You had one other question?
Yeah, we have a couple more. This is from Jeremy at M Weekly. Have you heard back from the state regarding home rule?
You talking about the letter? No. I mean, I did talk to Jimmy Petronas. Like I said, we did send that up there, that letter. I haven't heard anything back, and I haven't seen any position by the governor. And again, I think it was interesting. I think last year in March, a couple of times I told you I look back. I was a history minor and certainly enjoy history. One of the things that I was able to do a lot last week, assuming that everything works out with the vaccine. My daughter may have an opportunity through her college, to go to the London School of Economics next summer. And we were looking at the possibility of going over to see her. And one of the things she wanted to do is see that part of England and then go over and do part of France and the Low Countries over there. So I spent a lot of time looking up things in the Netherlands, and it was fascinating. I mean, granted, it was associated in the 1600s, they were associated with religion, but it's so interested the way it almost comes down to, I mean, masks have almost become a religious issue in the sense of it is gotten so much into our belief of the way we are. There's an interesting figure, William of Orange, who really sort of led the Low Countries into independence. And it was interesting just reading about him. He grew up a Protestant, then became through his uncle, he inherited stuff, then had to become a Catholic and other stuff. So he kind of gone back and forth. And to him, it wasn't a matter of necessarily, he was able to see both sides of the picture. What he couldn't understand is why there was this conflict and why people were arguing. And his whole goal was not that we should be doing argument, but that we should be making decisions based on the Netherlands, based on local condition and impact. And I was like, oh my God, I feel like I'm right in the middle of where William was, the same kind of position. It's just always interesting to see areas. That's why I certainly enjoyed my week at home and able to sit there and read and do some other things and look at some stuff. But it was very interesting seeing, other parts. And I think it was interesting to see what happened in Dutch independence. It's so much there. If we can get to a point where we can quit arguing back and forth about whether we do mask or what do we do, or we just stay focused on how we make Pensacola better, we will become a better place, much like what you see happen through the 1600s and the independence of what happened and created the Netherlands. If we can stay focused on our local community and our local conditions and what we do and able to make our decisions based on what it creates the best Pensacola, we are going to be so much better in the overall picture. And history shows that through communities that have had the same kind of debates, the same kind of issues, no matter what the topic is. It's the ability of the communities to see past the topic and the conflict to how both sides can work together. And that's I think what was interesting to me in the time I had to spend a little bit and look at some stuff. So it was interesting. It just confirms, nothing new ever happens. It's always happened beforehand. You have a chance to go back and look at the arguments in a different way, but they all generally point back to the same thing. That's the great thing about history. That's the reason you study history. You have a chance to see the same patterns. The issue may be different, but the overall backgrounds of what's happening are so much more the same, and you learn from them. I think that's why we should be focused on what happens locally. Those decisions should happen locally. They should happen on local conditions. I asked the governor, I said, I don't believe there should be any statewide mask ordinance, but I also don't think there should be any statewide ban because the areas of Florida, it's so different. Northwest Florida, we ought to be able to make those decisions on what our conditions are. And if we're down under 50 hospitalizations, we should be able to take it off. If we get over 75 hospitalizations, and certainly when we're at 237, we should be able to have a mask ordinance and require everybody to do that. Now, granted, again, I understand this is pushing everybody toward the vaccine, and we want to do that. We want to get everybody vaccinated, but there's going to be a lag time, and I think we still need that ability to wear masks, to do what we can. But hopefully, everybody is taking is heeding what's happening seriously and takes the opportunity to go in and get the vaccine. That's really our best way out of this. I think secondarily is the mask, but vaccine is the number one way, and that's what we want to make sure that everybody's getting and find a way to get a long-term solution.
This is also from Jeremy at M Weekly. Did you participate in any events like a bike giveaway during the period when you contracted COVID but had yet to get a positive test?
I was at the on bikes situation, and I have been fascinated by why everybody seems so interested. If you notice in on bikes, you'll see on there from Casey, you'll see pictures of me with I was with Jared Moore, Lumen May, Jared's family, Walker Wilson, all of these individuals, none of them got COVID. I was out front, I biked, I was on the very front of the bike portion. I was with John Hutchinson. Again, none of these people ended up testing positive in this position. I certainly realize there's much to be made that was there, but from my standpoint, we didn't find out that my son even had COVID until after that was over. I quarantined myself, but even after discussions I've had with Department of Health, they were like, that would have been too early. You would not have been passing it at that particular time. Same thing. I talked to Keith back here last Monday, because I came to work Friday after I contracted it Thursday night. I came to work Friday, but again, from everything we had seen, I mean, if you argue science, you have to stay with science. And if the science says that's not there, then it's not as big of a deal. I mean, it was a case of a point where I was not yet contagious, just like I was not contagious when I was here Friday at work, based on everything we had heard from the Department of Health, and we had communicated with them. So as soon as I found out my son did have a positive test, again, I quarantined myself and was there. But those are the things you work with. That's why you want to know as soon as you can. And it's important to get those turnaround times so that you can make those decisions correctly and move forward.
This is from Andrew McKay. Can you clarify what role CPAC will play in the search for PPD chief? Do they have veto power? Is their approval required?
Andrew, no and no, but they do have input. They have input. They're certainly there, and they have the ability to create it. And what we're trying to do is centralize a time. They're having these meetings, so we thought it would be good to allow one of their meetings to be the particular time that they give input. However, I want to be real clear. You don't have to be a member of CPAC to give input. We're looking for input from the regular public. So the only people making the decision will be City of Pensacola employees and myself, and those would be the people that actually make the decision. So there's no veto power, no nothing else. But we do take input from citizens. CPAC is certainly a part of it, and because they are meeting and they are scheduled and will be scheduled with you to have that time with the media, it would be wise for us to have a session, which we are shooting for the second meeting in January, which I don't off the top of my head was the 19th, I believe. The 19th of January will be their second meeting, and so we will be looking to have input, and they will be providing input, and we will look to see what kind of input they provide. But input will not only be limited to CPAC. You don't have to be a CPAC member just to give input. We want to get input from the public as a whole, but we certainly appreciate those members who are CPAC. So we thought we should take one CPAC meeting, allow that to be dedicated toward providing input, and give those individuals the time to make comments. The person that will be helping us on the search will be here. It'll be a good time for them to hear for that person to hear from the CPAC. But CPAC is not the only people we're getting information from. We're getting information from all kinds of citizens. We certainly look to get information from the police themselves. So we'll be a part of that process. We've now, I think this is the third press conference. We've kind of told you exactly what we have going on and how we see that happening. Is sort of we get to this point. I think Ted has a better idea. Kircher, who has got this individual to help them in HR. He's got a better idea as to what we can do, and as we get the specifics on that, we'll be rolling it out. But the CPAC is not going to be the only opportunity the public has to give input. We will be looking for other opportunities to get input from the public. But again, as I said, the last press conference, I gave you the individuals within the city that will comprise the team that will do the assessment with the individual we've hired, and they will be the ones that will be working through. And then it's been typical with all those positions we've hired. Once they bring it down to about the top three, I'll be involved in the interview process with them on that last group and the finalists, and that's when we'll make a decision. But at this particular time, we are going to be taking citizen input. You don't have to be on the CPAC, but we will be having an input session for the CPAC in the second meeting in January. But you do not have to be a CPAC member to give us an update. We want every citizen to have the opportunity. to give us input, and we are interested in what every citizen communicates to us. And again, several citizens have told me, listen, they've communicated to me, sent me emails. They were very happy with the union letter. I'm like, that's great. I mean, we want as much input as possible. So we want input, and we will make a decision based on that. But we are moving forward with the search. And if you want to provide us input, that's what we want. We want to take input from all citizens, whether you're on the CPAC, just a regular citizen, whatever it is. We value your opinion.
All right, and we don't have any more questions.
Well, thank you very much. Look forward to next week, and hopefully with my computer, it won't have been 2 weeks since I was last here, so we won't be slowed up by it updating as I'm trying to get on here. So I apologize being a little delayed this week, but happy to be back in. Happy to be just looks much brighter and different in 2021. Other than that, we hope everybody that you can, and if you have the capacity to do so, and you're eligible for getting a vaccine, we hope you will do that. And we look forward to catching up with you next week. We'll have better information from our conversation with the hospital, and we'll look forward to catching up. Thank you.